Good day and welcome everybody to FSMA Fridays. As always, we're very grateful to have so many of you join us today. My name's Jennifer Kenyon and I'll be your host for today's session. Looks like we've got a great crowd today, and today we're going to be digging into the topic of nutritional labeling requirements. We'll talk a little bit more about that as we get started. But first, I'd like to welcome everybody back and say for those of you who might be joining us for the first time, we're excited to have you here. If you're new to this webcast, our focus is to touch on recent changes, activities, and related news about the FDA and FSMA, and to discuss industry trends that we've seen as FSMA has taken shape. It's also a great opportunity to hear, learn from, and ask questions of the leaders in this industry with the Acheson Group. The folks from TAG co-sponsor these sessions and have been great supporters in the industry and great partners to work with, not just with our clients, but in providing this as a service to the food industry community. And on the software side is where we do our part. At Safety Chain, we have a food quality management system for food safety, quality assurance, and supplier compliance, so we've got you covered on both bases. Before we dig into what's new with FSMA and launch into this month's topic, we have just a few housekeeping tips regarding today's webcast. We try to keep these sessions pretty informal. These are part training, part conversation, and we hope you enjoy that format. We also know that these are important and serious topics, and they tend to generate lots of audience questions. We encourage you to ask questions, so don't be afraid to ask them. We try to answer as many as we can during the session, but if we come up against time constraints, we're happy to follow up with you after the session. So feel free to submit your questions using the GoToWebinar Q&A panel. We'll monitor those behind the scenes and save them for the end. In the interest of everyone's privacy, only panelists are displayed and attendees are on mute. We are recording this session and we'll be sharing the recording along with a slide deck afterwards. The last detail before we get started is that we're on a webinar tool and sometimes technology doesn't cooperate as we hope it will. So if you do have any audio issues, we'll do our best to help you. But usually the best way to solve any audio or connection problems is either changing your audio source, so you can either use your computer or you can use the phone, or just log out and log back in. That usually solves the problem. We'll touch really quickly on a few FSMA updates and then dig into this month's FSMA focus, which is changes to the nutritional labeling requirements. And then we'll wrap up with a little bit of Q&A. Today we're joined by Eric Edmunds, Director of Food Safety at TAG. Eric has joined us for FSMA Fridays many times in the past, and we're happy to have him back with us today. He is a registered environmental health specialist with the NEHA and has over 10 years of legal, regulatory, and food industry experience. Welcome back, Eric. It's good to have you back on FSMA Fridays.
Hi, Jennifer. It's good to be here.
Thanks.
Thanks for having me.
Sure. To kick things off, let's talk about the latest FSMA news. Eric, I understand that you have some FSMA updates to share.
Yeah, just one really. As we've noticed, FSMA has been around for a couple of years now, and the FDA had taken a lot of time providing a lot of guidance, especially for the human food rules. Since the last FSMA Friday, they've come out with one new guidance regarding the supply chain for the preventive controls for food for animals. Pretty similar to the human food rule. It just goes through, it's about 50 pages or so, and covers basically what a supply chain program in the animal food rule should look like and what it should include. It goes over some of the appropriate verification activities that customers can do to approve their suppliers and how they should be using only approved suppliers. It goes over how on-site audits could be used for verification activities, and kind of covers, in a conclusion, the records that would be required for the animal food program and the supply chain area.
Okay,
and that's
great.
That was about it for as far as new guidance. And then we've been kind of just seeing FDA continue their inspections and continue training. hearing about more and more preventive controls inspections and foreign suppliers inspections, but nothing specific on those at this time. But that's about it for the new FSMA news this month.
Okay, thanks very much for that update, Eric. Let's move on to today's focus, which is revisions and changes to nutritional labeling requirements. Eric, I'm going to hand the reins to you here.
Okay.
And you should have control of the slide deck.
Let's double check this. Make sure it's working. There we go. Okay, yeah, so I'll just start with this slide. It's not a true FSMA focus this month, as you notice. It's dealing with another FDA regulation, the Nutrition and Labeling and Education Act. Just because it's been in the news recently and has some kind of changed compliance dates and has some actually a little more guidance that has been come out in regard to this rule. And just to provide a little background, this is what we'll be covering, the two major rules that change the nutritional labeling aspects, the revision of the actual label and the revision of serving size requirements. And I'll go over, at least mention some of the guidance documents that have come out to help with the new Nutrition and Supplemental Facts label. But just to provide a little background, kind of like FSMA came around in 2011, the Nutrition and Labeling Act came around in 1990. That was the first time the FDA ever had full authority to require nutrition labeling and disclosure of certain nutrients. And at that time, they created guidelines for certain voluntary disclosures, health claims, nutrient claims, and things like that. But overall, the nutrition labeling facts is based on they call it the total daily diet of the American population. It's set up with a set of the daily reference values and recommended daily intakes, which are what you see on the nutrition panel as the percentages that people would be consuming. And so daily reference values were established for total fat, saturated fat, cholesterol, carbohydrates, dietary fiber, sodium, potassium, proteins, and then daily intakes were set up for vitamins and minerals. And for children under 4, they established that as for proteins as well. And it's basically that's the amount of vitamins or minerals or proteins that the average person would need to consume each day to maintain a healthy lifestyle. So it's a generality in the nutritional labeling requirements that they're generally applicable to the population and anyone 4 years of age and older. And the idea is not that they're going to cure any illnesses, it's that they're going to prevent certain public health issues from becoming worse and more drastic within the United States. We'll kind of talk about those: diabetes, obesity, things like that. But it's important to note that there are separate dietary requirements and nutrition recommendations for young children and infants. And as far as other populations that are pregnant women, things like that, they can obviously consult with their medical doctors about that. But the question becomes, why update the regulations now? And the reality is it's been over 20 years since the regulations had been updated. So there's been a lot of improved science, leaking, diet, and public health. So I mentioned the obesity, but high blood pressure, cardiovascular disease. And then in reality, people just aren't consuming the same portions of food that they used to be consuming. And so that's why the reevaluation of serving size came into play, so it can reflect more appropriately what people are eating, not what they should be eating, in a sense. Because that's actually a statutory mandate that the serving sizes and nutrition should reflect actual consumption, not a recommended consumption level that people should be eating, but reflecting what people are actually eating. So it's been a long process with the rules, and the original public rulemaking comment period started in 2002, and what we're getting into now finally is some actual compliance dates for what will happen. So for manufacturers with 10 million or more in annual food sales, January 1st of 2020 is the compliance date. And for those with less than 10 million annual sales, January 1st of 2021 will be the actual compliance date. So I'll jump into actually what they require. Here's a quick summary of kind of the changes, the differences that have been come around in the nutritional labeling requirements. And along with those, I'll get into them later, the difference in serving sizes and reference amounts customarily consumed, that part about referencing the part that the amount that people actually are consuming. So I'll just stick on this slide for a little while and kind of go over these and why they've been added or changed. Basically, for added sugars, the science has shown that it's nearly impossible to get the proper nutrient consumption when sugars attribute to over 10% of your daily calories. So the health evaluation is recommended that adults should be consuming no more than 50 grams of sugar or 12 teaspoons, and children 25 grams or 6 teaspoons. Largely linked to cardiovascular disease is why this has been added, but previously there was just a total sugar content, and now we'll get into the example in a little bit that compares the previous and new label. Added sugars is separated from that part and declared separately and in addition to what would be a natural sugar in the food group. There's just a short hairline in separating the two, and they're not considered two different categories. Some of those examples are syrups and brown sugar, high fructose corn syrup, maltose, honey, molasses. Concentrated fruit juice counts as an added sugar if it's concentrated to the point where it's sweeter than what the 100% fruit juice would be. So those will all be considered added sugars. And there's some new guidance around those, specifically how to declare added sugars on honey, maple syrup, and certain cranberry products. And these were some industry petitions that basically said these products, it's almost a marketing disadvantage to have added sugars in these, because number one, honey and maple, we're not actually adding any sugar. That what would be considered an added sugar is naturally occurring. And for certain cranberry products, like dried cranberries or tart cranberries, just in the, I guess, the processing and to make them palatable, enough sugar is added that it declares much more added sugars than another dried fruit product or something, although the total sugars end up being somewhat similar. They just have to add them differently. So these were some petitions submitted by industry where FDA kind of gave them a little leeway in how they declare added sugars. And for all of these, it basically allows them to put a little symbol next to the added sugar area. And for cranberries, for example, it would have to say, sugars are added for palatability and in limited amounts, and does not necessarily make them unhealthy. And for honeys, it has just an aspect that talks about how all these sugars are naturally occurring in honey. There's been some pushback on that as some comment periods have been coming out on those guidances, and it'll be interesting to see what FDA does in the long run, especially in regard to honey and maple syrup, because they seem to have the most, even consumer pushback on why they would have to declare added sugars in a product to which there are no sugars added. Jumping to the next one, the new label really highlights calories and serving size. You'll notice in the example that they're much larger type and they're in bold, just looking to address the obesity issues. Some of the daily values have been updated, and I can jump to that one. So for example, the total fat, it used to be recommended that 65 grams was the daily value. Well, it's now been increased to 78 grams, and that's just in recognition that not all fats are bad. It's just a change in a scientific opinion that depending on the fats you're consuming, they can actually be very healthy. A lot of the others stayed more or less the same. The two to note would be potassium and vitamin D as two new required nutrient declarations. And those values both changed as well. Vitamin D actually used to be a 10 microgram daily value recommendation that didn't have to be declared, and now it's 20 micrograms that has to be declared. And potassium jumped from 3,500 milligrams to 4,700 milligrams. And they're just really noted as aspects of human or of the U.S. population's diet that have been lacking in the past. So they're going to require those declarations because they're things people are watching for more now. And as the contrary example, vitamin C does not have to be declared on a label anymore. So there's a few changes like that. There's some clarifications on trans fat and dietary fiber. I'll touch on it a little bit later, but as most of you know, trans fat, partially hydrogenated oils are no longer deemed GRAS by FDA. And so there's a deadline upon which they can no longer be included in foods, depending on if certain petitions had been filed and things. And I'll touch on that a little bit later. And finally, dietary fiber. Previously, it's been established that just any fiber could be declared on a nutrient label, whereas now it has to be shown that it has a physiological benefit to human digestion. And there's some specific requirements. FDA has recognized what they consider a dietary fiber that gives a physiological benefit, and they've provided guidance on how you can petition to get another dietary fiber added to that list. But as of this point, they have not necessarily proven that many other petitions than what they have formally evaluated. Finally, with everything, there's records requirements. This one actually comes most importantly to added sugars and dietary fibers. Once a sugar or a fiber is in the product, there's not a great way to test to determine which was added and which was naturally occurring. And so what the FDA is having companies do is keep records of their justification for their declarations on sugars and dietary fibers and a couple other minerals if they are declaring on those as well. So here's the example, the difference between the two. And if you look at it, they kept the general format the same. They didn't want to drastically change anything, but you'll notice that, so as I mentioned, vitamin C is no longer declared on the second label, but the big things are the switching of serving sizes and calories into much larger and bold type. You'll notice the total sugars part down about 2/3 of the way on the new that says total sugars 12 grams and includes 10 grams of added sugars with just a short hairline in between the two. And that's just the specific language means that is a total of 22 grams of sugars. There's a specific required daily footnote or daily value footnote now that you can't alter the wording. It has to be word for word, and that just to provide that basic guidance that it's based on 2,000 calories and may adjust for different people. The other thing you'll notice is on declarations for vitamins and minerals, they declare both the milligram or microgram amount as well as the percentages. And that's just a reflection of doctors don't usually tell people I need you to eat a percentage of vitamin D. They're usually saying it in milligrams, and this allows people to more readily evaluate that per doctor's recommendations. So I'll jump to the second section, this serving size rule, which is the other one. Basically, the FDA has a table in the Code of Federal Regulation that lists all the different categories of food, or many of them anyway, and the amount a person customarily consumes in one sitting. So for part of this rule, they went back through that, just going through consumer surveys, just general knowledge, everything like that, evaluating new submissions, and they adjusted all of those. They changed about 30 of them from what they had previously done and accepted about 25 new submissions from companies that were just looking for clarification on what their serving size would be due to a new or unique product. But these are the biggest ones are ice cream moving from half a cup to 2/3, yogurt actually going down in serving size, and while beverages moved from 8 to 12 ounces just to reflect that single can of soda, which that one actually becomes a lot more, I guess, demonstrable in the next section, which talks about dual column labeling. So this is just a requirement due to serving size. Anytime it's a single serving, so it does not exceed 200% of the reference amount customarily consumed, that container would have to be declared as a single serving. So the person knows the total calorie intake, fats, all those things, without having to do any calculations in their head. So while a 12-ounce can of soda is one serving, a 20-ounce bottle of soda is also one serving because it does not exceed 200% of the 12 ounces. Mm-hmm. And then there's this other one for dual column labeling for when it's 200 to 300% of the rack, or it's a voluntary option when the package contains 150 but less than 200%. So could be consumed in one sitting, but could also be consumed in 2 sittings is really how that one's looked at. And I pulled up just the example of the dual column labeling to show what this 200 to 300% dual column label would require. It requires you to, all the other requirements that we kind of looked at in the previous one were standard, but this one just requires the per serving and per container declaration to be included within on the label, just for clarity. And just to close out, I just wanted to say there's a lot going on in labeling right now, so I'll just mention these other things that are things to watch out for, things to look for. Menu labeling is here, which is basically the declaration of calories at restaurants that chains 20 or more locations. USDA GMO, the bioengineered food disclosure, just recently had a comment period close, so it'll be something to watch to see how the USDA responds to those. The partially hydrogenated oils have new compliance dates that they can no longer be put in food after June 18th last month, but they could technically still be on the shelf. And there were some petition uses that didn't go, that have 1 year that they may still contain partially hydrogenated oils. FDA is going to be looking into standards of identity this upcoming year. Could deal with anything. And as always, Proposition 65, based out of California, is requiring a newer disclosure as of August this year, which is the same but different words. So if there's any questions on those, I can jump into those, but I just wanted to briefly mention all those ones in conclusion, but I also want to leave time for any questions if you have any. So I'll turn it over to Jill. Jen,
sure.
Jennifer, sorry.
Sure, no problem. Thanks, Eric. We do have some questions from our audience, and I'll start with this one. Will the formats remain as is, or are changes expected? And the person who asked this question indicated the website says for reference only, and I believe they're referring to the FDA's website.
Yeah, so kind of how we went over in some of those examples, the format looks basically the same, but it is different, requiring those new declarations for added sugars and some of the different ones for vitamin D, potassium. As far as the for reference only, I believe what she's referencing is on the FDA website where they kind of have their catalog of labeling information around the two major rule revisions. They have example, they're actually, I believe, the same ones I showed you, example nutrition labeling panels. And what they're getting at is they don't want someone just to cut and paste these onto a different example. And obviously that people they're focusing that people should have to do their own evaluation without just cut and paste, I believe.
Okay, another question that came in, where can you find a list of those products that have had their RACCs changed?
I just drew a blank on which section of the CFR that is. So the best way, they don't necessarily have a great red line available, but there is a table in, it's 21 CFR Part 101, I believe, is where the actual table is. If you also just Google FDA's website, they have some downloadable PDFs of the tables, and it's a guidance document, but it includes that CFR table directly on their labeling page.
Okay, great. Another one, this attendee asked for clarification on when the bioengineered food labeling goes into effect. She couldn't quite hear what you had said. If you could just clarify.
Idea.
You don't know?
Yeah, so they released some example images and kind of what wording they would be requiring, and that was open for a public comment period, and I believe that actually closes on July 3rd.
Oh, okay.
And then USDA will take the time to evaluate that, and that's the part I don't know. They could take a month, and they could take a year or longer. That part is unpredictable a little bit.
Okay, we have a couple of questions about the added sugars. First one is, if prepackaged ingredients have these added sugars, not the product itself, do we need to declare in our label the added sugar?
I may need to touch base with that person offline. I'm not sure that I totally follow.
Sure.
But yes, I think that one may be a little more specific.
Sure, no problem.
If it's a topping that's packaged that comes with your product that you expect the person to add, you would have to declare it, but I'm not sure how you could get a prepackaged product that's an ingredient that's not going to be part of the finished product. So
right.
But yeah, we can touch base offline for that.
Okay. Another is this person had asked for clarification. Could you go over the new sugar labeling requirements for total sugar and added sugar?
So it's the natural occurring sugars, and then you have the added sugars that are included in the hairline below it, which are combined to make the total sugars.
Okay, great. All right. Okay, we are running up against our 30-minute mark, and although we do have a couple more questions, we'll try to get those answered for you offline. And I would like to mention that between sessions, you can continue the conversation on FSMA Friday's LinkedIn group. The group is a good resource for engagement, and we periodically take these session questions offline. It's a good place where you can have discussions amongst yourself about food safety and FSMA. And if you're not part of that group, go ahead and head over to LinkedIn, search the groups for FSMA Fridays, and request membership, and we'll get you approved. And along the lines of continuing the conversation, Eric and his team at the Acheson Group are experts on FSMA and can be a tremendous help in this area, whether it's around the rules and regulations or building out your plans and dealing with compliance issues. You can check them out at achesongroup.com. And on the technology side, we're able to complement what our partners over at TAG do to make the process of compliance more seamless, a lot faster, and more productive for your company. So if you're looking for technology to help complement the work that you're already doing around compliance, whether it's around food safety and quality assurance or on the supplier compliance side, we've got some great solutions, and you can learn all about them over at safetychain.com. We'd like to wrap things up by telling you about a few resources. We will be sending out the session recording, and we'll get that link and the deck out to everybody by early next week. We host a monthly educational webinar series called Beyond Compliance. There's no cost for these webinars, and they're a great opportunity to learn from leaders in the industry. We also host monthly demo days, and you can find details about both of those, Beyond Compliance and the demo days, on our website at safetychain.com. And once again, check out TAG's newsletter. It's a great resource for industry news and insights. Next month, FSMA Fridays will be on July 27th, and the format will be an open Q&A with Dr. David Acheson. We've hosted previous sessions in this format, and they're wildly popular because you can get your most pressing FSMA questions answered. And if you'd like to submit questions in advance, feel free to do so via our LinkedIn group. With that, we'd like to thank all of you for joining us. And Eric, thank you very much for putting together a very informative presentation today. Hopefully we'll be able to talk you into coming back again very soon.
I'm glad to do that. Thanks for having me.
Sure. Thanks, and thanks everybody for joining us. See you next month, and have a great weekend.